A very good afternoon, everyone. Today, from ekincare, we are presenting COVID-19 awareness session during this third wave. I'm Dr. Lavanya. I'm an internal medicine doctor, and I will be talking about the Omicron variant, how we can be better prepared during this third wave. So, starting from the pandemic, beginning of the pandemic, that is from last 2 years ago, from March till now, there have been many variants. And the reason for this is that mutation is a natural process for a lot of these viruses. When a virus is a newly infecting a human being, when it is transmitting from person to person, in the beginning period, it is very natural for the virus to mutate and take new forms. So we call them variants. While many variants are very close to the beginning variant, sometimes the mutations can be kind of huge. More number of mutations can happen, and it can deviate in structure from the original variant. So if you see alpha, beta, gamma, delta, omicron, all these variants we were seeing in pandemic, and currently we are dealing with omicron variant in India. So when so many variants are evolving, why is it that omicron is announced as a variant of concern by World Health Organization? Usually the health organizations, especially World Health Organization, takes certain criteria before it declares a particular variant as variant of concern. We call it VOC. So the few factors they see is, one of the factor is how fast this virus is spreading from one person to another person. We call it transmissibility. We call the number or not. In the beginning, the Delta wave was infecting, maybe one person was infecting 2 to 3 people. But currently, the Omicron variant's transmissibility is high, and one person may be infecting more than 6 people. So the transmissibility is very high. So this is really concerning. Whenever it spreads so fast, the health systems will be overburdened. More and more people will be infected in a short period of time, needing health care. Sometimes entire household may be infected. So that was concerning factor that is taken into account. The other factor is that how lethal or how virulent is this virus? How does it affect human beings? Is it going to be producing mild symptoms, or is it going to cause severe symptoms leading to a lot of hospitalizations and deaths? So far, the good news is that Omicron variant is causing milder form of infections so far. Though we will not and we cannot say that it does not cause severe infection, comparatively, compared to Delta variant, the infections have been milder. But the initial concern was that because so many mutations happened on spike protein, and because it is different from the previous variant, maybe it could cause severe infections. It may escape from the immunity that is produced by the vaccines. That was their concern. One of the speculation was that because all the vaccines are produced for mainly targeting spike protein producing producing antibodies that target spike protein, and in this variant lot of mutations happened on spike protein encoding gene. One of the concern they had was maybe people who got vaccination also will get severe infection. So with these concerns, they did declare this as variant of concern. So this is theory, right? Now let's see what exactly is happening in reality. Did this immune escape happen? Is this really causing severe infections? So let's look at that. Let's specifically talk about this Omicron variant. More than 30 mutations happened on spike protein gene. Yes, it has more transmissibility. It is spreading fast. The numbers are increasing fast. But one good thing is that comparatively, this is totally in comparison. Comparatively, the virulence or the severity it is causing is less. In some studies from South Africa and some other places where they had more number of cases before India had, in those studies, it was noticed, it was concluded that this particular variant, Omicron variant, is affecting mainly upper respiratory tract. It is involving lower respiratory tract in less number of cases compared to Delta. Because of that, less number of hospitalizations happen, less number of deaths happen. That's really a comforting issue. Whenever lower respiratory tract is involved, or generally pneumonia is a concern, lung damage is a concern, long term pulmonary complications, pulmonary implications are common. Similarly, when severe inflammatory response happens, the body goes into severe inflammatory storm. Inflammatory markers go up. We call it inflammatory storm, and the body takes a toll. So far, it is noticed that Omicron is causing less of that. Less of that. Um, and because of that, less number of hospitalizations were happening. But one word of caution here is that no two people are alike. We have seen it during the second wave, when four people got affected in the entire household. Two people probably got better. One people probably had milder, moderate kind of this thing, and they just got admitted and they got discharged. And one person probably ended up having severe infection and ended up in ICU. So it varies from person to person. This information should not make us relax and violate all the norms, the precautionary measures that we were taking. We should still be vigilant. We should still be under the understanding that there are people who are at high risk for serious infections, which who I will list those categories in a minute. So we still have to be careful. Now, because a lot of mutations happened, because there was a concern that will this Omicron have this phenomenon called immune escape. What about the vaccination drives? What do we do? Are the vaccinations really helping? The answer is yes. The vaccinations are really helping. We should continue the vaccination. A lot of people in India had only first dose. They should proceed to have the second dose. People who had both the doses, they need to still practice precautionary measures, because from the beginning, complete prevention of infection was never the promise made by the vaccine. Total 100% prevention was never the promise made by the vaccines. Vaccines promised less severe infections, less hospitalizations, less deaths. We need to remember that. And it is still the same. Though there are anecdotal evidences of a person having moderate infection after both the doses of vaccine, a person may be hospitalized after both doses of vaccine, but we need to remember vaccines are still helping. Still, the severity of infection is less compared to people who did not take any dose of vaccine. Two doses are better than one dose, and that still holds true till today. The vaccines are still keeping the promise, and we need to proceed with vaccination. And in this context, I want to just mention a couple of things. After the vaccination drives in the initial days, many people had antibody titers. They were comparing with two vaccines, Covishield producing antibodies, Covaxin produced antibodies, comparing the titers, the numbers. Some people got spike protein specific antibodies, and people were following the titers. Titers were going down, hence there was even more worry that is my vaccination effect waning. Yes, to some extent, antibodies are a measure of how well you can fight, but we all need to remember that is only one point. That is only one aspect of immunity produced by the vaccines. That's the only thing we can measure, and that's why we are focusing more on it. But there are other ways vaccine produces immunity. What is the other way? It's called T cell immunity, cellular immunity. Whenever a foreign organism is attacking population, whenever a vaccine is given, the body has certain memory of the structure. The body remembers few things about this foreign body. And it is not always reflecting in antibody titers. It does remember, and the body's natural defense, next time when we are infected, it produces antibodies fast. It is better prepared. The fighting power in some unmeasurable ways is much better. So it is more than what we can measure. So we call the T cell immunity, the memory of the body about this foreign body or about the vaccine, what is given to the body. So just don't, let's not just focus on antibodies and worry that titers are going down. Maybe we are not immune anymore. There is this T cell immunity that still protects us. We need to remember that. Now, yes, after few months, antibody titers do go down. There will be some compromise. We do agree. We said some compromise, not complete disappearance of immune phenomenon. So there is some compromise. Because of that, all the countries are facilitating booster doses already. And with this emergence of third wave, Indian government, Ministry of Health and Family Welfare, they have also declared the facilitation of vaccination of certain groups. Now let's see who are those groups. The first and foremost is that children between the ages of 15 and 18 can get the vaccine now. And the drive has started on January 3rd. Many children are already vaccinated with no problems, and it is still going on. If you have kids between this age in your household, 15 and 18, between the ages of 15 and 18, do get the vaccine for these children. And the vaccine that is approved as of now is Covaxin, because in India the studies are done majorly on children on about Covaxin, because we have data, we are more comfortable facilitating this, and it is safe, and many kids have already gotten it. So register your child for vaccination. The second change, the second announcement that the government did is allowing vaccination with a booster dose. They are calling it precautionary dose. So, booster dose, precautionary dose, they're all the same. It's just a difference in the word. So, they are facilitating this booster dose in certain age groups who they feel are vulnerable for severe infection. So, who are these people? Their exposure is more, they are more at risk for getting infection, or they are more at risk for getting severe infection. Hence, they have released um, guideline for facilitation of booster dose for these workers. Who are these? Healthcare workers, doctors, nurses, frontline workers, whoever is actively involved in the care of population, who come in contact with general public in crowded places as a part of their line of duty, and people aged 60 and above if they have comorbidities like diabetes, hypertension, heart disease, asthma, COPD, and immunocompromised state like severe liver failure, kidney failure, and transplant patients, people who are on immunosuppressive medications for various reasons. All these people can get the vaccination. While I'm talking about this list, these people are the people who are at increased risk for severe infection. When we talk about isolation and quarantine, we will again talk about this group on how to protect them better. Now, coming to the symptoms of this variant and testing for Omicron. Are the symptoms really different? Do we need to know a bit more? Or can we differentiate Omicron from Delta? Can we differentiate this COVID, whether it is Omicron or Delta, from common cold or flu? The answer is no for many of these questions. We cannot definitely differentiate. We may have certain clinical feeling, but we cannot certainly say just based on symptoms that this is Omicron and not Delta, or this is Delta, not Omicron, or this is a common cold, or this is flu, not COVID. We cannot say that because there is so much of overlap between the symptoms. Okay. Compared to Delta variant, currently the Omicron variant is causing more severe sore throat, Fever is common, but maybe this time high fever is comparatively less common. Body pains, yes, one of the common symptoms. Loss of smell and taste was more profound. This symptom was more common during the Delta wave, not so much now, but people can still have. People can have red eye. Even now, we have seen some people who had positive cases with just conjunctivitis, no other symptoms. GI symptoms like nausea, stomach upset, not feeling well in the tummy, these are also common symptoms. So, in a nutshell, whatever we saw during the second wave, during COVID second wave, that is Delta variant, we may be seeing more or less the similar same symptoms, but with slight variation. And it is very difficult to say with these slight variations that this particular variant is Omicron. Okay. Similarly, many people, when they have upper respiratory symptoms, they may say that this is just common cold, let me not test, or let me not go for testing, or they may just go to their work, or they may mingle with other people. Really, there is no way to say that this is common cold if you have sore throat, because common cold and COVID both have sore throat. Both can have dry cough or a slightly wet cough. Body pains are very common for flu and COVID, though comparatively less common in common cold. Common cold, you may feel completely drained and tired and down. So these are small variations. It's very difficult to say that this is such and such case based on these small variations. So now, what is the take home point? Only testing will let us know whether it is COVID or common cold, and that too with not 100% certainties. Now let's take point by point. What is this testing? Still, RT-PCR is the best test. There were some messages circulating that RT-PCR is not good anymore. Ignore those messages. RT-PCR is still the best test, the standard test for COVID-19 detection. So by all means, get RT-PCR test done. If you have rapid antigen test access to that, that's also fine. But comparatively, RT-PCR has more accuracy. And self-test kits are also fine, but rapid antigen, RT-PCR, or self-test kits, if they're positive, you can believe it with reasonable certainty. But if they are negative, you need to remember that false negatives are common. False negatives are common. So you need to remember that I have symptoms, false negatives are common, I have typical symptoms, so better to be in isolation till I get better. So always stay in isolation till your symptoms get better, till you're not transmitting, you're not actively coughing, sneezing anymore, so that you protect your household and your colleagues at work. So now during a second wave, almost till 40% of cases were falsely negative. This time it may be even more. Um, uh, Hence the advice. Now we all know that many people do get better with COVID. Few people can have moderate disease, can be admitted to a hospital ward, and very few people can have severe cases and they can be admitted to ICUs, critical care units. So when we said many people will be taking care of themselves at home, today we are going to be talking about precautions and advice to those people, because once a person is admitted in the hospital, generally healthcare workers do take good care of them. Similarly, in critical care units, they have a lot of people to take care of them. So today our focus is mainly on the care of people who have mild symptoms and who are staying at home. And our focus will be mainly on how to recognize if this person who is having mild symptoms is entering into moderate category or severe category. How do we recognize those alarming signs, and how do we um, measure certain vitals? We will focus on that. So, when it is decided this person is in home isolation, if the person is young, doesn't have any comorbidities, he can go into isolation. But if the person is above 60-year-old, or or if this person has any of the conditions that I mentioned 5 minutes ago, that is diabetes, hypertension, heart disease, COPD, that is chronic smoker's disease, chronic lung disease, severe asthma, immunocompromised state like severe kidney failure, liver failure, and kidney transplant, liver transplant patients who take immune reducing medications, immunity reducing medications, any other people who take medicines that reduce their immunity for various other conditions, autoimmune conditions, all these people, or any severe infections, if they're taking active treatment for severe infections, all these people fall under vulnerable groups. For these people, for them to decide, I will be in home isolation, they need to take a doctor's consultation. They need to take a doctor consultation, preferably a video call, and they need to have doctor's prescription that they can stay in home isolation, mainly to make sure we are not missing anything, the person is not missing anything. Sometimes it's difficult to judge whether we are really doing well, or we may be having some alarming signs. So it is always advisable for these people and to take a doctor consultation as soon as symptoms start, or when once the test comes positive, follow up with the doctor and make sure you're okay to be under home isolation. Once that is done, whether it is a vulnerable person or other people, they need to know the alarming signs of infection getting severe. All the people in home isolation, they need to know these alarming signs so that they are vigilant and they seek medical help in case their status is changing. What are these alarming signs? Difficulty in breathing, we call it shortness of breath, and dip in oxygen saturation, especially if it is going below 93%, or sudden drop. You may be having 99 till yesterday, sudden drop till 94. If pulse oximeter reading is good, I'll talk about that in a minute. Sudden dip or pulse ox drop below 93%, shortness of breath, chest pain or tightness, constant tightness around the chest, high grade fever that is not going down beyond day 4 or day 5, high grade fever, severe cough, the cough that is not just mild, not just dry, severe constant cough, or blood streaks in the cough, and those people with high risk factors we already talked about, and these people should be worried very early, not just wait and watch. Severe fatigue, severe fatigue that you're not even able to get up from the bed, not able to take few steps in your room, not able to go to bathroom, that means something is wrong, severe infection has started, or you're extremely dehydrated. A doctor needs to evaluate. And drowsiness and confusion about the date, time, and drowsiness, not at all getting up and taking your food, taking care of your daily activities. These are the alarming signs. Now, how do you know? One thing is the caretaker going into their room when they're giving food and other supplies, just to assess, talk to them whether they're doing fine, they're looking good, are they looking different from the day before, are they looking toxic, are they looking sick. That is one thing that everyone will do when it comes to their family members. But there are certain things either a caretaker or the person himself or herself need to check. So this is the chart, whatever I'm showing here. From the time of starting of symptoms, so starting of positive test, please to record these, because the reason for recording this is that many times we may be measuring pulse ox, we may be measuring temperature many times in a day, and the next day we are confused. What number did I have yesterday evening, or did I have low number in the morning or evening, or was it day before yesterday or yesterday? These kind of doubts are very common. So if we record, we can see the progression. Progression is important. Is the person getting better? Are the numbers looking better? Or is the person getting worse? That is one important parameter, not just typical numbers, not just the numbers, but the progression or trend is important. Hence, all these need to be recorded. The first column is date and time. The next one is temperature, whether if the temperature is consistently above 102, 103 degrees Fahrenheit, you need to keep an eye. Heart rate, a pulse oximeter not only gives pulse oximeter reading, oxygen saturation, it also gives heart rate. You can take from there. SpO2 or pulse oximeter reading, the oxygen saturation reading. And the last two columns are whether you are feeling better or worse, whether your breathing has deteriorated or remained the same or worse. This is important. So record these, and I want to mention a couple of things about pulse oximeter reading here. Always buy a good one, good quality one. And when you're measuring it, take certain precautions. Do not use any pulse ox readings that can be attached to a cell phone and you'll be recording through cell phone. Those are not accurate. Those are not accurate. Use proper pulse oximeter, number one. Number two, especially because it is winter now, if your hands are extremely cold, warm them up a little bit. Just rub hands together and warm them up a little bit, and then measure your pulse oximeter reading. And sit quietly in a comfortable place, remove your mask, and breathe normally. Breathe normally, just take nice breaths, and then wait for 30 seconds to 1 minute once you put on the pulse oximeter. Don't keep on taking the readings in the first 10 seconds. Make sure the waveform is good on the pulse oximeter. You waited for 30 seconds or 1 minute and then record the reading. And if there is any nail polish or nail paints, remove those before you measure the reading. So let me repeat: good pulse oximeter, sit down comfortably, breathe normally, remove your mask, remove your nail paints or anything that is there. Put the pulse oximeter, wait for 30 seconds to 1 minute, make sure the waveform is good, only then record it. Okay. Sometimes a low pulse oximeter reading may alarm you unnecessarily. Always know your baseline. Sometimes chronic smokers, people who have smoked many cigarettes in a day for years, they may have a baseline low pulse ox reading. So it's always good to measure your pulse ox reading once or twice when you're not sick. Generally, just to have an idea, so that you're not suddenly alarmed and think that this is a big sudden drop. You know your baseline, that's good. Okay. Now, these general principles, by now everyone knows that the person should not mingle with vulnerable people in the family. If there is a pregnant woman, babies, elderly people, and they should not be going to social gatherings, and their movement should be limited in the house. We all know this. Now, coming to treatment and follow up, when do you end the isolation, and when you're in isolation, what kind of medicines you may be requiring, and what kind of care do you need? The first and foremost, these physical distancing. You're confined to a room, preferably a well ventilated room that has an attached bathroom, yeah, make sure you have some basic facilities where you can have good time, at least to some extent. Because COVID isolation can be really taxing on the brain, and people can really feel low and dull. They can have a mild kind of depressive symptoms when they are in isolation, because it's not natural thing to sit in one room and not to mingle with other people. So make sure you have your phone handy, do video calls, entertain yourself well within reasonable means. Then the symptoms. The treatment is mainly symptomatic. If you have fever, take paracetamol. In your medical kit at home, you should have paracetamol, you should have cough syrup, you should have N95 masks, and a temperature monitor, and some multivitamin tablets in your kit. So always um, take plenty of fluids, not including colas and caffeinated beverages. Any other beverages are fine. Take plenty of fluids, fruits, just good diet, freshly cooked good diet, with rich in vegetables, and take a lot of fluids. You can take paracetamol for fever, and cough reducing medicine for cough, and multivitamins. Generally, if you have been taking for many months, I mean, you can just continue. If you haven't taken, doctor may give you multivitamins for few days. Vitamin C may be given. Again, vitamin D we were giving for every person during second wave. If you recently took it, few sachets were taken by you once a week, then no need for a new prescription now, and no need for testing now. But if the doctor feels that you might still need, they may give a prescription for vitamin D. But beyond this, currently we are not giving any antibiotics or any one particular antiviral medicines. Medicines like hydroxychloroquine, medicines like azithromycin, amoxicillin, doxycycline, ivermectin. All these medicines we are not giving because for typical COVID, they are not really beneficial. They're not really beneficial. So there is no requirement of these medications. One important word of caution: do not share prescriptions, do not follow somebody else's COVID prescription, because these medicines are tailored to each person. The doctor feels that a certain person may need additional medicine, they may add. So, better to be freshly evaluated and then take the prescription. Rather than following someone else's WhatsApp forwarded prescriptions, it's always good. And another important thing is that many times people take the first consultation, but they lose touch with the doctor's team. Always keep in touch until you're out of the isolation, until you're completely safe. The follow up care is important. So keep in touch with your physician. Sometimes if you have taken a package from certain corporate hospital or from certain healthcare setup, it may not always be a doctor. A nurse may be in touch with you. She will record your status and will update the doctor in case if there is any concerning symptoms. That's also fine, but follow up is what is more important, especially for people in vulnerable groups. Follow up is extremely important. So about prescription, we already said that there is no standard prescription, and prescription differs from mild cases to moderate cases to severe cases. Once the mild case is changed to moderate case, or if there is any worry of deterioration, or if there is any worry of risk, doctors will give some other medications. It could be steroids, it could be some other medications like remdesivir or antibody cocktail, or admission, and usually these are given when you are admitted to a hospital. So do not insist on these prescriptions. Everyone do not require these prescriptions, and the benefit of these medicines vary from person to person, based on certain criteria, based on certain contraindications. In some people, some medicines cannot be given, and as certain people may benefit from one medicine over the other. So there are certain criteria, there are certain clinical features doctors look at. Hence, following with your doctor is important. Now, completing the isolation is important. When do you end isolation? There have been changes in the guidelines because the numbers are more, and because comparatively the virus is being transmitted less after certain period. Taking all those studies into consideration, the government has made a recent change in the guideline about ending of isolation. Currently, if you have completed 7 days from the positive test result and had 3 days of symptom free period, you can end the isolation. Please note that there is an and, not or. So that means you need to meet both the criteria: completing 7 days from the time of positive test, and should be symptom free in the last 3 days. So, when I say symptom free, what I mean is severe symptoms like high grade fever, shortness of breath, chest pain, drowsiness, all these things. A mild cough doesn't come under a symptom because you're already getting better. Residual cough, little bit dry cough will take a couple of weeks. Similarly, tiredness. A little bit of tiredness will be there. If you're walking around, if you're doing fine, just because you have little bit tiredness, you don't need to stay in isolation. Okay. And of course they need to continue wearing mask. And one important point is that uh, COVID affected persons, they do not need retesting before they mingle with others, they finish isolation. All the health systems, all the guidelines across the globe, they do recommend this, not to test after the proper isolation is done. There are many reasons. One, over testing is being done. The second one is sometimes the test can come positive because there are remnants of the virus is there, though the person has recovered. So this falsely positive test in a COVID infected person may alarm people, may cause a lot of worry and anxiety. And there are some other reasons. So repeat testing after isolation is not required. And now another change in the guideline is that asymptomatic contacts of infected individuals, they do not need to undergo COVID test because they don't have symptoms. If they develop symptoms, by all means they need to get tested and they need to be in home quarantine. But if a person is asymptomatic, just because they came in contact with this COVID positive person, if this person is asymptomatic, he doesn't need to be in home quarantine. This is a major recent change. Now, coming to vaccination, we talked about booster dose for some groups, and we talked about the eligibility for kids. Now, coming to the details of booster dose, some countries were okay with giving taking another vaccine as a booster dose or precautionary dose. In India, currently, the government has said that the booster dose has to be the same company's vaccine as your first two doses. That means if one of you took Covaxin, the third dose has to be Covaxin. If you took Covishield, the third dose has to be Covishield. And do not worry much about that. Yes, combination may have slight edge, but you're not missing, you're not compromising your immunity a lot. You're not compromising on your advantage a lot. So go ahead and take whatever is your first vaccine, go ahead and take. But there has to be 9 months interval between your second dose and your booster dose, or 39 weeks. In other words, 9 months approximately. So the booster dose is given only after 9 months or 39 weeks from your second dose. Okay. Now, coming to workplaces, what kind of precautions need to be taken? Same as before, limit big gatherings, and it's even more important because the transmissibility of this particular Omicron is very high. So, limit gatherings, big gatherings, social distancing has to be practiced. Always, if meeting 4 or 5 people is inevitable, then arrange in an open area where air circulation is good, and mask all the time. When you're meeting people, it's better to wear N95 mask. In all other times, when you're going for a walk or when you're going to a place where really you're not coming across many people, then you can wear surgical mask. But if you're going into a room of a COVID positive person, if you're a caretaker, both of you, the person who is COVID positive and you both need to wear N95 mask. And if you're going into big gatherings, N95 mask is definitely better than regular surgical mask. And stay home when sick. And contact tracing, in case of positives happen, it should happen at workplace, because at least the person should know that they have been exposed to COVID positive person. That way they can keep an eye, and if they develop symptoms, they can get tested. They have to get tested. That's about the information for today, and we will take questions now. So the lot of questions we'll take one by one. The gap that you need to give between the second dose and booster shot is 9 months or 39 weeks. 9 months or 39 weeks. Somebody is having a good sense of humor. Yes, background noise. Sorry about that. Covaxin is effective for Omicron. Specifically, general understanding is that Covaxin, because the entire virus is given, killed virus is given, the general thought is that Covaxin may be a little bit superior to the mutant variants, but we cannot put a number on how much of an advantage it might have. Is it really having an advantage? Because unless really strict studies are done, we cannot comment on that. But definitely, Covaxin is potent and effective. If a person had taken Covishield vaccine, is that booster should be the same or it should be the a different one. Currently, the government is allowing the same vaccine. So you have to go for Covishield. If you took Covishield, go for Covishield. Do not worry because both are reasonably good. Both have their advantages. It's better to take a booster than not to take. So go for Covishield. Maybe in future government may give different guideline, but until then we only have access to the same kind of vaccine. When will booster dose be available through ekincare? It is already available. You can book the vaccine dose because the fact is that you can actually walk into any healthcare center. So definitely you can book in ekincare, check your nearest center, and go to vaccination. Is RT-PCR for COVID and Omicron are same or different? A very good question. The test is same. You're going to book the same RT-PCR that you're booking for Delta, and there is no way with RT-PCR to differentiate between COVID and Omicron. There may be certain clues. Some labs give some additional information. There may be certain clues only doctors can pick up. These are also certain clues, but they will never say this is Delta or this is Omicron. Based on your clinical course, based on the RT-PCR, certain number, CT count, and we call it as gene dropout, there are certain things. They may have a clue, but definitively we cannot tell. You with the same RT-PCR, and the only way to know whether it is Omicron or Delta is through gene sequencing. Now, to order gene sequencing in every person is not really useful. Sometimes, when they feel the treatment may be different, they want to go aggressively. If it is a Delta variant, they want to know, then they may order gene sequencing, but otherwise, they may not order gene sequencing. In hospitalized patients, they might order. If there is no loss of smell or red eye symptoms, not having body pains, but seems to be a common cold, but it turned out to be positive RT-PCR. Anyway, the test to differentiate. No, actually, it will not. The same thing that I was just mentioning, it cannot differentiate. Are there any cases of people who didn't fall ill or feel no body ache after taking both the shots? Do they need to worry? No, they don't need to worry. Each person was reacting in certain way in the same household. One person may have some symptoms after vaccination, and another person may not have any symptom. So do not worry if you didn't have any problem after vaccination. Are asthma patients at higher risk? What precautions can they take? Generally speaking, yes, because you already have a underlying lung condition, especially if it's severe asthma, you are at increased risk for severe COVID. But the precautions that you need to take is avoid the triggering factors of asthma. If you're taking baseline medications, do not stop the medications. And if you are exposed to COVID person, get tested immediately and follow up with the doctor. Is booster dose necessary for 34-year-old male who already took 2 doses of Covaxin? No, they're not facilitating it for 34-year-old man who already took two doses unless he has any severe health conditions. That also after above 60 only they are allowing. So it is not required. You're in a good condition. You're in good shape because you're comparatively young. You don't have any other problems. So you're good. But soon the government will gradually expand this booster dose availability to other groups. Then you can take. My mother has taken 2 doses of Covaxin 7 months back. Is it advisable to take booster dose now? Her age is 59. So, as per typical guidelines, she has to wait for some time. And like I said, 9 months is the period that the government is saying, not 7 months. That way also you have to wait. Sometimes some healthcare centers may be giving, they may not be strictly following the 60 years group. They may be giving your mother, but you need to wait 2 months to get that. C-reactive protein levels more than 10, is it a concern while taking the vaccination? So it depends, right? Recently, were you sick? Recently, did you have COVID or any other illness? Is that why C-reactive protein is high? In that case, if you're better, you can go for vaccination. But for no reason, if you're having high C-reactive protein, you need to maybe better wait and then get the vaccine. General advice is that when you're acutely sick, do not get vaccination. That's the general advice. So if it's just an ember, you are okay. But you just had an infection, not completely better. That's why your C-reactive protein is high. Wait until you get better. The simple logic is that when vaccine is given, your body has to produce antibodies. If it's in a good condition, if the body is, if we are feeling well, the immune response will be good. If you are already sick from some other illness, then you take vaccine, then you have side effects of vaccine, you'll be really drained. uh, that's the reason for this advice. So could you cover a bit about COVID management in children and infants? Generally, the treatment is pretty much similar, symptomatic treatment, and we always say that follow up only with pediatrician, because when you follow up with an adult doctor, they will know more about the management of adult patients. So they may certainly miss the deteriorating symptoms of an infant. Like for example, in an infant, not taking proper feeds, a change in sleep and wake cycle, and and a change in diaper habits, all these things may be alarming. Because of that, follow up with the pediatrician, and that is the best advice that I can give, because I usually treat adult people. Thank you. Lactating mothers, can they take vaccination? Yes, they are eligible to take vaccination. They are eligible. Someone is waiting for the baby to be 6 months old to take the first dose. No, a long time ago, the government has included lactating mothers into vaccination schedule. They can take. So no need to worry. Should multivitamin be taken as a precautionary measure? See, general advice is that when someone is not having good gut health, most of us who don't have any gut problems, gut related symptoms, who don't have any chronic infections, chronic conditions, we absorb all the nutrients fine, provided we take a balanced meal. So, in the conditions that I'm going to list now, you can take multivitamins. What are these conditions? You have any gut problems, you have irritable bowel syndrome, you are the kind of person who frequently have diarrhea episodes because of irritable bowel syndrome, or you have gut related problems like severe acid peptic disease, you take regular antacids because of that, or you have inflammatory bowel syndrome like chronic Crohn's disease, ulcerative colitis, or you have a chronic diabetes, which probably leads to decrease in gut motility, or you have severe liver failure, kidney failure, compromise of those, or you're the kind of, you or your household, a person in the household, elderly people, they cannot take certain meals because of their certain GI problems or allergies. You constantly limit your dairy intake, or a certain food items, intake of certain food items, then you please take multivitamins, but not indefinitely. Don't take for months and months together. You can take for 3 months, give 3 months gap, then again take 3 months and give gap. So news is going around now that quarantine is for 7 days only after a contact, since the symptoms show up in 3 to 4 days. The question is, I'm not able to understand the question. If you can be little clear, um, but um, if you're generally asking about change in guideline, yes, isolation period is cut down to 7 days compared to initially it used to be 14 days. Then they made it 10 days. Now it is 7 days. And this is not without evidence. Across the globe, they are doing it. So 7 days is the isolation period. But if you can be specific, I can give a specific answer. Any recommendation for vitamins? Generally, in the past, for common colds and certain respiratory illnesses, zinc was really helping. So, Zincovate or any multivitamin that has zinc. I don't want to take brand names here. Multivitamins, so many brands are available, right? Just make sure it has zinc also in it, and other all the daily recommended doses. Lot of things are available. Lot of multivitamins are are available, and then they don't have to be expensive ones. Some are comparatively um, uh, at a reasonable price compared to some other. What is the waiting period for a person to take vaccination off after Omicron recovery? So, if you're talking about the person who already had two doses and then got Omicron, you can easily wait for 9 months. But if you haven't taken a single dose and then you're talking about Omicron infection, then wait for 3 to 4 months minimum. Because, see, getting an infection is like taking a vaccine, taking one dose of vaccine. So you're good. I don't see booster dose in ekincare. It just says dose 1 and dose 2. Okay. This we will reply to this question in the chat box. One of our operations people will reply. Um, okay, please do check after some time. Okay, we will certainly get back to you. How many days kids who got affected with COVID will be cured below 5 years? See, generally, by 10 days, they do feel better. Their symptoms will be better. They may have little bit of fatigue, little bit of, remnant cough. Those things you might see. Again, it changes from mild infection to moderate infection to severe infection because kids generally, most of them are having mild infection just like adults. In generally in 10 days or 2 weeks, they will be fine. um, how effective are self test kits for testing? um, so these are good, uh, but they're little bit inferior compared to RT-PCR. If they're positive, yes, but if they're negative and if you're still having symptoms and if you see symptoms deteriorating, go for RT-PCR also. Okay. Are kids getting affected with Omicron? Yes, kids are also getting affected. Only sore throat which is lasting over a week, could it be considered as a yes, definitely yes. Sore throat lasting beyond 1 week, definitely a typical symptom of Omicron, a very typical of Omicron. Do zinc and multivitamin supplements help against COVID? Not really. See, these are not for prevention of COVID. These are only to make your body, have strength to fight with the infection. They do not prevent. In case if you have deficiencies, you're a picky eater, you always had deficiencies, you had some gut problems, then your response to the infection in general, not just COVID, any other infection, you will be a little weak to fight. That's all they help for. What is the first starting symptom of Omicron? Is it dry cough or cold? Generally, cough is more common for COVID cases compared to cold. And during Delta, it used to be mostly dry cough. Now, sometimes people are also complaining of little bit of phlegm. It's not like copious amounts of phlegm. Little bit of amount of phlegm is also common. So, general statement is yes, cough is more predominant for COVID than cold, but it's not 100%. What is the best booster dose? The available, like we said during vaccination, right? Whatever is available to you is the best vaccine for you. Currently, the government is only giving the same dose, same company's vaccine that you took before. So, very few small studies by some healthcare organizations, there was a slight edge if you take a different vaccine, but because of that, nobody wants to wait. If they're eligible for booster dose, please go ahead if you're eligible. Yeah, she can take a booster dose. Your mother can take booster dose. Is there any possibility of fetus contracting COVID? I mean, see, when fetus is in the mother's womb, you don't need to worry. Whatever is mother's health will affect the fetus. But if you're asking specifically about during the delivery time, yes, if the mother is having active COVID during the delivery time, there is a chance that kid will have, because naturally kid is close to mother. It has to come through birth passages, and And just for that reason, kid will not be separated for too long from the mother, because breastfeeding, the antibodies from the mother do more benefit than the COVID that mother is giving. So yes, during the delivery time, the kid is at risk. But before that, we just generally take care of mother's health. We don't worry about, fetus, because what if the mother is producing antibodies, fetus is protected. In fact, if mother is taking vaccine during pregnancy, the antibodies will help the fetus even after birth. That's the whole point of the newborn vaccinations, right? We give newborn vaccinations, MMRs, TPTs, and all that. So we usually give them after 6 weeks. Now, how are they protected the first 6 weeks? The mother's antibodies will protect them. Thank you. I don't know about this. Mothers, vaccine causing low milk supply in lactating mothers. Unless it's a big study, I wouldn't worry about that. Generally, the mother's milk supply decreases if she's under stress, if she's dehydrated, if she has any kind of infection, if she's under tremendous physical or psychological stress. For some reason, if baby is separated from the mother, even for 2 days, the milk supply goes down. It's all supply and demand, because there are so many factors involved in milk supply of mothers. It will be little too premature to blame the vaccine for the low milk supply, unless the study is really big and really valid study. Are young vaccinated adults with chronic conditions like PCOD and pre-diabetes at higher risk for developing complications post-COVID infection? Not so much. Generally, in the list, severe diabetes, I mean, beginning of pre-diabetes, they're okay because they're managing their health okay. The sugar levels are not that high. They haven't had diabetes for many years. So generally, they're okay. Same thing with PCOD. Don't worry too much, just manage your condition. So another question, my mother is having heart disease and diabetes and recently diagnosed with COVID, whereas she got her first dose of vaccine uh, in October, a month before. Yeah, some infections. Okay, the follow up is that how long do we need to wait to take the second dose? You said that your mother had the infection in November 15th, right? You can take in February, December, January, February. Give 3 to 4 months time and get the second dose. What are the ingredients of kada? I mean, probably I'm not the best person to advise. Generally, ginger is good. Um, I know that much, and kada, better to talk to your the elderly at home. They may be wiser to give this advice. But yeah, by all means, you can take kada. And since we are on the topic, many people ask whether steam inhalation, saltwater gargling, they are beneficial or not. By all means, generally in cold, at least they give symptomatic relief. They don't prevent the infection, but they give you symptomatic relief. So twice a day is okay, but don't overdo it. So twice a day is okay. And so is kada. Don't take a lot of kada throughout the day, because some of these beneficial ingredients can also cause stomach irritation if taken in higher quantities. So a couple of times a day is fine. Is it good to take RT-PCR test on first day of symptoms, or should we wait to get accurate test results? See, general observation is that by second day, your yield may be high. If you're the kind of person who can isolate yourself the first day itself, you have that discipline, then book take on second day, that's fine. But your isolation, other decisions should not change because you're taking test one day late. Isolation should be the same, monitoring should be the same, um, and symptomatic medication should be the same. Don't slack there. Second day is fine. If children get COVID below 6 years and recovered, what are the good? Maybe you are talking about good food items. That word is missing. So generally, balanced diet is good. Food that is rich in protein, vitamins, and antioxidants. So, what is in this category? Fruits, vegetables, nuts, and whole grains. Fruits, vegetables, nuts, and whole grains, and dairy. Usually, kids take dairy. All these in a balanced way. Balanced meal is good. So, Ministry of Health and Family Welfare has reduced home isolation from 14 to 7 days for COVID positive cases. However, there is no updated guideline for home isolation of close contacts. The last version says 14 days. Yeah, they may not have updated, but there was advice in, if you go through the same revised document of home isolation guidelines, they say that asymptomatic contacts do not need to be in isolation. So underline that word, asymptomatic contact. And if they are symptomatic, so the same guidelines, symptomatic positive cases, the same guideline holds true, right? 7 days. Symptomatic positive case, or if they are falsely negative, they're symptomatic, same guideline as COVID positive people. So there is an answer in the same document. If you have cold or cough, after how many days should you go for the test for COVID or Omicron? First or second day is fine. Do not delay more than that. Like another person was asking, if is there a benefit in delay by just 1 day? Yes, maybe the yield will be slightly better, but do not delay more than that. And like I said, always isolate yourself. Don't stop any other precautions just because you're getting test 1 day late. Will prior Delta infection help a person get, if a person gets infected with Omicron? There is mixed thought in this, but many people say that if you had COVID infection before, it's just like vaccine, right? You have challenged your body, you have introduced a foreign organism into your body, and hence your body is better prepared to fight. So, most people think that you are in a better situation to fight, but lot of scientific evidence is not there. Um, Studies have shown that virus has been found in organs up to 230 days and replicate other than the respiratory tract. No need to worry about all these things, because I don't know how valid are these studies. How valid are these studies? Don't worry about that. Uh, Go with your general home isolation guidelines, and it's the clinical symptoms we see, whether they're staying in the organ for so many days and all that. I don't think these are valid studies. So I would like to know if a sore throat or trouble swallowing could be COVID or positive. In all these, you have the sore throat as symptom, and let me remind you, in COVID, it is one of the common symptoms, very very common to have sore throat, and cold and flu also have sore throat. So just based on this symptom, we cannot differentiate um, whether it is cold or flu or COVID. Please do get tested. How does COVID affect people with history of heart disease? Because they have heart disease, their pumping capacity may be low, and and the challenge to the heart will be high compared to people who don't have heart disease during high fever, during the fight with the infection. So that's why they are kept under vulnerable groups. These are the people who are at increased risk for getting into moderate to severe disease. These are the people who are at risk for desaturations, shortness of breath, and all those things. So definitely these are at high risk. So if you have these people in household, if they are COVID positive, take doctor's consultation, and regularly until they get better, follow up with the doctor. Cod liver oil capsules once a week, yeah, you can take. I mean, there is not a problem. There may not be too much of a benefit also. They are good for cholesterol problems. They may have little bit of vitamin D, but beyond that, not much proven benefit. Is it true that Omicron is spreading through air particles? Previous Delta variant was spreading through droplets of infected person, as far as I know. So if you remember, even in a Delta, initially we said they are spreading through large droplets, but in the midst of Delta wave, some research has showed that it is spreading through small droplets. In other words, we are saying that it is small droplets fly in the air, right? Some large droplets fall onto the floor and surfaces because they are large, because of the density, because of the weight. But small droplets, they do travel in the air a little bit. So it is same for Omicron also. That's the reason when you go into gatherings, when you're going to take care of the going into the room of the patient, always wear N95 mask because it protects from the small droplets better than a surgical mask. It's kind of valued when there is 1.2 million people with long COVID with no explanation as to why symptoms still persist. Maybe, no, we cannot say virus is in the body, hence they are having long COVID. See, long COVID has lot of other reasons. See, when your lung is getting affected, if you have mild fibrosis of the lungs, your breathing capacity, your oxygenation goes down. So naturally, that leads to tiredness, that leads to decrease in exercise capacity, that leads to shortness of breath if you exert yourself. And because of the severe inflammatory markers that happened during the inflammatory damage, that was causing long term damage. And coming to psychological effects, feeling low, brain fog, and feeling anxious anytime you're in isolation for any disease, that too we're talking about pandemic, people do get worried. How much ever we say people are getting better and all that, how much ever we do counseling, people do worry when they have a major pandemic disease like this in the midst of pandemic. Hence there are psychological factors. So all these things are playing a role. Saying that the virus is staying in the body organs and that's why long COVID is happening is wrong. So there are so many other proven causes. Thank you. Is there a need for gap after taking hepatitis C vaccine or Heripeg for iron injection and booster dose? Generally, we advise 2 weeks, 2 weeks gap between two vaccines, because when you give one vaccine, the body is dealing with that immunity production, right? General practice is wait for 2 weeks. Same is the case here. I have a cold with sneezing and runny nose, but no coughing or sore throat. Can it be COVID or common flu? Again, it sounds like cold and sneezing little bit more common in common cold, but initial day it may be like this. Tomorrow you may have sore throat, you may have severe body pains. When in doubt, get tested. But from clinical judgment, generally common cold has runny nose and sneezes and that kind of coryza we call it, whereas flu has severe body pains. COVID has more of sore throat and other symptoms. But even doctors cannot differentiate with reasonable certainty because there is a lot of overlap. So do get the test. If a senior citizen with comorbidity got infected with COVID and recovered in December last month, do they need booster dose? Yeah, but wait for 9 months because they just recently got it. So they will have good immunity because the infection has challenged their body. So you may want to wait for some time. Thank you for your appreciation. When will third wave end? We don't know, but some scientists are having some positive. Um, they are they are of the thought that probably because it is transmitted so fast and many people are getting infected, and many people are also getting vaccination and now booster dose is happening. uh, some are optimistic that after this Omicron, are we will we be in a better situation where most of the population is either infected or got vaccinated, herd immunity is built to a reasonable extent, and comparatively Omicron variant seems to be mild so far. Again, whenever I say this, I again say let's not relax because there are some cases who do deteriorate, and that is happening. But in the big picture, some scientists are having a positive feeling and optimistic that uh, we will learn to live with COVID, and we may be looking at somewhat an end or milder variants of COVID. But virus always gives surprises, right? When it mutated into Delta, it was more potent. If that happens, nobody can guess. If that happens, then their speculations may go wrong. But many people are very uh, they're having positive speculations. So thanks for your appreciation. I mean, everyone in the country, I think already a lot of people are affected. If you notice now, there are a lot of asymptomatic positives happening. It may not be entire country, but many people maybe at some point they may be saying, I had COVID very soon. Thank you. RT-PCR needed after 7 days of isolation? No. When you are ending the isolation, RT-PCR is not at all recommended. Only in few cases doctors do recommend. Immunocompromised people, severe hospitalizations, they were in ICU. In those cases, doctors do order. But general people who were in home isolation, who got better, they don't need RT-PCR. Does rapid antigen kit work for Omicron? Yes, it does work. Since there are no more questions, we will end the session. Thank you for your attention and your time. Take care, everyone, by following all the precautions for the COVID. Thank you. You're welcome.